Do you have a fear of holes? You may have trypophobia. Trypophobia is the fear of holes. People with trypophobia usually experience a feeling of disgust or fear when they see something that has small holes in it. Some people with trypophobia are so afraid of holes that they can't even look at a sponge or a piece of Swiss cheese. Society and culture. The word trypophobia is believed to have been coined by a participant in an online forum in 2005. It was meant to describe an extreme fear of holes or holes themselves, but it has taken on its current meaning in the past decade. Groups on social media sites such as Facebook and Instagram exist for self-identified trypophobics to share and discuss images that induce the reaction. Trypophobia, also called phylokeratosis or rosacea syndrome, is an aversion to images containing small round holes, or pits. The disorder was first described in 1994 and has since become well known to the public. Many people are unaware that it is an actual medical condition. Trypophobia has received a lot of attention in recent years. The first American Horror Story episode about the condition aired in 2017, but 2017's trypophobic reaction to the show was likely not the beginning of a trend. In fact, trypophobia is a real phenomenon, and it's been increasing over the last few years. You may have even experienced a trypophobic reaction to something, or maybe you're just aware that trypophobia is becoming more common. There are several theories about the origins of trypophobia. Some say the condition is due to the increased level of detail in the images. Others suggest that the combination of shapes and textures is responsible for triggering the condition. What is trypophobia? Trypophobia is a phobia that often causes one to feel a strong sense of disgust when observing things with a clustered pattern on them. It is commonly experienced in the form of feelings of discomfort or panic when trying to avoid contact with such items or in reaction to seeing a person wearing them. Fear is a typical symptom, but disgust is often cited in people's overwhelming emotions regarding this phobia. Trypophobia is also often triggered by images in real life and on the internet. Images of irregular, lumpy, bumpy, or squishy shapes can leave people feeling very uncomfortable. Signs and symptoms of trypophobia. One study of trypophobia, or fear of clusters of small holes, showed that some people had cognitive reactions, others physical reactions, and yet others were both. Skin-related reactions include goosebumps, itchiness, or feeling your skin crawl. Physiological reactions include dizziness, trembling, shortness of breath, sweating, body shakes, racing heartbeat, headaches, nausea, or vomiting. What are the symptoms? If you have trypophobia, you'll likely feel a strong emotional response to objects or surfaces that have a lot of small holes or protrusions. You might even experience a sense of disgust and discomfort in reaction. This is called a pavor aesthetic. A study published in 2018 by researchers at Cornell University suggests that although many people think of phobias as associated with fear, most people with trypophobia report experiencing disgust rather than fear as the primary symptom. You may start to feel frustrated, furious, or anxious when thinking about something that has this appearance. If, for example, your partner starts telling you how delicious strawberries are, you may start to envision the fruit. Specific symptoms of a heart attack may include feeling faint, having chest pain, chest tightness, trouble breathing, and nausea. Also, rapid heartbeat, dizziness or lightheadedness, visual discomfort, eye strain, distortions, or illusions are symptoms. What triggers it? Trypophobia can be both visual and tactile in nature. This phobia might be triggered by looking at lotus seed pods, honeycombs, or even the teeth of a spider. Also, strawberries, corals, seeded bread, Swiss cheese, scabs or lesions on the skin, aluminum metal foam, pomegranates, sponges, pebbled or gravelled roads can trigger. Some people with a fear of holes avoid irregularly shaped holes only because of the fear of the unknown. Surfaces with holes of the same size can lead to discomfort for people who are visually impaired. People with sight problems often have difficulties distinguishing between uniform surfaces and small gaps. What causes trypophobia? There is no clear cause of trypophobia, but some experts believe the aversion comes from a fear of venomous and/or dangerous creatures. Other researchers have theorized that the aversion could stem from an aversion to highly packed things and have a small amount of space between them. Spectral properties include contrast, spatial frequency, and color. They can affect how your eyes and brain process images. The fear of holes may not be entirely unfounded. Some people are afraid of black holes. However, the fact that we don't experience the feeling of being trapped in a black hole is simply due to our limited understanding of gravity. Many people who experience trypophobia have an aversion to scab-like bumps and rashes. In fact, it is believed that many people who have this phobia also experience a strong aversion to anything that may indicate germs or contagious skin conditions or illnesses. Are there any risk factors? Although studies into the cause of trypophobia are just beginning, Those diagnosed with it have experienced a strong and uncomfortable reaction to certain images containing clusters of small holes. While this condition may be very rare, and no one is entirely certain what causes it, many people who have become aware of it report that it is triggered by an image of a small animal that has been attacked by another creature with small, barbed claws. Trypophobia may be related to your terror after encountering a venomous snake, a contagious skin condition, or another type of trigger. The triggers will cause your reaction, and there are a few out there to consider. In 2017, researchers found a possible link between trypophobia and major depressive disorder, as well as a generalized anxiety disorder, GAD. Researchers surveyed 195 adult members of a trypophobia support group and found that 19% of participants had a diagnosis of major depression, and an additional 17% of participants had a diagnosis of generalized anxiety disorder. In contrast, an additional 3.9% of participants had a diagnosis of social phobia. In a new study, participants who reported they had social anxiety also reported a strong reaction to certain geometric patterns that mimic the shape of human eyes. The findings could explain why social anxiety is often accompanied by eye-related symptoms, such as staring and avoiding eye contact. If you see clusters of holes, you may experience a sensation similar to being watched by numerous eyes. However, in most cases, this feeling is not actually caused by the presence of eyes. Still, it is because you are in an environment with high levels of ambient light and are also more aware of your surroundings as a result. How is it diagnosed? Phobias are usually only diagnosed by a mental health professional like a psychologist or psychiatrist. In fact, it's hard even officially to diagnose a condition like trypophobia. All the same, they can certainly recognize when the appearance of clustered holes in a web page makes them feel highly distressed and offer them guidance and support on dealing with their intense anxiety over that issue. They may offer a more specific diagnosis of specific phobia. If your mind is going in different directions, it's worth asking a therapist for some guidance. They can help you identify any other mental health issues you live with, including signs of anxiety conditions or depression, by asking questions about your symptoms. Therapy can be defined as a therapeutic intervention. How to treat trypophobia? There is not currently a cure for trypophobia, but there are ways to treat the symptoms. It is essential first to identify that you have trypophobia and then seek help from a therapist. Some self-help tips can help manage the condition. Therapy. Phobias can be treated with various therapies such as CBT and exposure therapy. Exposure therapy uses repeated experiences of stimuli associated with a fear to decrease the fear response in a controlled environment. Therapy for anxiety attacks teaches you how to cope with these fears and stop them from happening again. Exposure therapy is the most widely used form of therapy for fears. It involves learning how to manage feelings and beliefs associated with the feared object. CBT techniques can be used to develop skills for managing overwhelming emotions, including feelings of anxiety and fear. For more information about therapy for phobias, visit the American Society of Clinical Psychopharmacology website. You may also find help at the National Institute of Mental Health or through local mental health clinics. Medication. There is no medication explicitly treating trypophobia. However, a psychiatrist or other prescribing clinician may consider recommending medication to treat the symptoms that you describe. Other approaches. Your therapist may also suggest other strategies to help you manage anxiety and emotional distress, such as relaxation techniques, including deep breathing, yoga, and meditation. Exercise and meditation are two proven ways to help deal with stress and anxiety. There are a lot of different techniques out there, and many people have great success with just one. But what if you're not sure which ones work best for you? Good self-care is something that many people have trouble doing. They tend to prioritize getting their work done or meeting other obligations at the expense of taking time for their own health, well-being, and happiness. A few simple tips to make sure you're getting enough sleep: aim for around 7 to 8 hours of sleep each night. It may be easier to do this at the beginning of your shift. Eating a balanced diet is essential to maintaining good health. Some people find that exercise can help them cope with their feelings and emotions. If you suffer from anxiety or depression, eating a balanced diet and limiting the foods that may cause anxiety or depression can be helpful. Duration of trypophobia. The duration of trypophobia is highly individual. Some people battle with symptoms, such as anxiety and fear, for their entire lives. Others can effectively control and manage their condition. Prevention of trypophobia. Inhale through your nose for a count of 4. Then exhale slowly through your nose for a count of 4. Breathe in through your nose for 4 seconds, hold for 3, and then breathe out slowly for 8. Repeat. In conclusion, trypophobia is a real fear that affects many people. If you are one of those people, it is crucial to understand what triggers your fear and work to avoid those triggers. There is no cure for trypophobia, but there are ways to manage the fear. If you are struggling with trypophobia, please seek help from a therapist or other professional.